everybody of Coppell. My name is Tip McGee and this is Bevo and this is my partner John Deere F. Today we are gathered here to tell you, the public, an announcement that might be of service to you. So, currently many people of Coppell have been diagnosed with necrotizing fasciitis. And we have an announcement to tell you guys, just in case you might have this disease. So, Mr. F, could you please tell us about the symptoms?
Yes, ma'am, I can. Howdy, I'm John Deere. Symptoms to necrotizing fasciitis, commonly known as flesh-eating disease. Your skin may begin to get real red like a tomato, and then it'll swell up and get puffy. This will be right around the wound that contains this disease. Now, after a while, it'll get real hot and start bruising and get real nasty, more or less. Then, as a very critical stage, you could begin to lose your actual skin. It'll just disappear like magic. Now, Miss Tits McGee, can you please help us understand how this can be transmitted from me to you and you to me? Because I'm not quite sure I understand.
Why, yes I could. Well, people usually develop this disease with a weakened immune system with things such as cancer or liver or kidney problems, but it is possible to develop this disease without having any kind of injury beforehand. Cancer, diabetes, or liver or kidney problems can make people more susceptible to this, and cuts or surgical wounds also increase this risk. People who just have strep throat or other type of strep infections are also very vulnerable to developing this disease as well. And we are going to go to Mr. F so that he can tell us about the pathophysiology of the disease, and that means what it actually does to your cells and tissues.
Thank you. The pathophysiology of this disease would be this. Necrotizing fasciitis begins to destroy the cells and the tissues, such as the skin tissue, that's right there, and the tissue underneath, such as the fats and fascia, which is the muscle. And treatment for this are pretty, well, you ain't got much options, to tell you the truth. You may have your arm or wherever the wound is amputated. There is some surgery or debridement and a very little antibiotics if it is caught in its very early stages. Besides that, there is no vaccine because it is so quick to spread by your body, and you know, that's about it. Prevention, could you please help us understand this?
Well, the prevention would be that you need to clean all of your wounds immediately after you get them, and you need to keep a watchful eye on them. You should also clean them not only right after you get them, but quite frequently, because a lot of this develops from these cuts. You should be watching for swelling and redness just in case you have this, and you must seek medical attention the moment you see any symptoms occur. Also, some other good things could be that you would probably want to stay away from people who have this disease and people who have strep throat. A map of it would be just a globe, because it can be found anywhere, but it's often found around the coastal areas. And so, did you know that, Mr. F?
I didn't. No, ma'am, I didn't.
You should have. This is a public service announcement. You should be educated.
I'm sorry.
Alright, so could you tell us about the statistics then?
Yes, I can. The statistics on this disease would be between 20 and 30% of the people who get flesh-eating disease will die. In 1996, they did take a survey, and there were about 500 to about 1,500 cases diagnosed that year, which has been said to raise by quite a large number now that we're in 2008. This disease can happen very rapidly and almost go into its final crucial stages into up to 24 hours.
Or 12.
Or 12, yes ma'am. Current research on this, Sophie, do you know much?
Yes, of course, because this is a public service announcement and I should know what I'm talking about.
Well, thank you.
Currently, scientists are actually, they are trying to find ways to make this disease actually decrease in its pace. As well, this is a very rare disease, and the most common form of this is the Streptococcus progenitus, which is caused especially after strep throat. It can produce a toxic poison that spreads rapidly over tissues, especially the fascia tissue, which is the muscle tissue. A more rare form of this disease is spread through contact with sea animals and ocean animals, such as crab bites or any kind of people that work with those sea animals, like people that work at SeaWorld, you know. And if you're also getting in the ocean with an open wound or something, you should probably watch that cut because you might be developing flesh-eating disease. This normally occurs in people who have low immunities. As I said before, cancer patients. Actually, people who take steroids are very susceptible to this because steroids weakens your immune system, so you should maybe cut back a little. But we are going to go to Mr. F to tell us what these grand people can do to help us from this disease.
Who would have known those little sea critters could be so hurtful? People can donate to the Howard Hughes Medical Institution, which is currently conducting a study and scientific advancements to help this disease and, well, get rid of it. They've discovered many ways to slow the progression of this disease and things that have helped out people with this disease. You can also donate to the LA Biomed, one of the country's largest non-profit independent biomedical research institution. This will help out very much to all the people losing their skin.
So basically what you need to be looking for is this disease in yourself, since it's becoming very common in Coppell. We have two pictures that might frighten you, but you need to see them because this might happen to you if you don't watch out. You can get that, cameraman. Can you see those clearly? Good, because that might be what happens to you, and that's not a good thought. So, this has been a public service announcement. Bevo and John Deere F and Tits McGee, we would all like to just extend a warm hand to you. Hope you don't get it. Anything else, Mr. F?
No, ma'am. This is a public service announcement, and watch out.